Welcome. Today, we're diving into the early warning signs of carpal tunnel syndrome, a common condition that affects millions of people worldwide. Carpal tunnel syndrome occurs when the median nerve, which runs from your forearm into the palm of your hand, becomes compressed at the wrist. This can lead to a variety of symptoms that may start subtly, but can worsen over time if left untreated. Recognizing these early signs is crucial for seeking timely intervention and preventing long-term damage. In this video, we'll walk you through the most common early symptoms, what causes them, and how you can spot them before they progress. Carpal tunnel syndrome is a condition caused by pressure on the median nerve as it passes through the carpal tunnel in your wrist. This tunnel is a narrow passageway surrounded by bones and ligaments. When tissues in the wrist swell, they can compress the nerve, leading to symptoms in the hand and fingers. Understanding what carpal tunnel syndrome is helps us better recognize its early warning signs and take appropriate action. The condition is especially common among people who perform repetitive hand movements, such as typing, assembly line work, or using vibrating tools. Catching carpal tunnel syndrome early can make a huge difference in your recovery and long-term hand health. Early intervention can help you avoid more severe symptoms, permanent nerve damage, or even surgery. Many people ignore the initial signs, thinking they'll go away on their own, but this can lead to worsening symptoms and a longer recovery process. By understanding and recognizing the early warning signs, you can take steps to reduce strain on your wrists and seek medical advice before the condition progresses. One of the earliest and most common warning signs of carpal tunnel syndrome is a tingling sensation in your fingers or hand. This tingling, often described as a pins and needles feeling, usually affects the thumb, index, middle, and part of the ring finger. It may start off mild and intermittent, often occurring when you're holding a phone, steering wheel, or reading a book. Over time, the tingling can become more persistent, especially at night, and may even wake you from sleep. Numbness is another early warning sign of carpal tunnel syndrome. You might notice that your fingers, especially the thumb, index, and middle fingers, feel numb or less sensitive than usual. This numbness can come and go at first, but may become more constant as the condition progresses. It's common for people to shake their hands to try to wake them up. Persistent numbness is a sign that the nerve is being compressed and needs attention. Many people first notice carpal tunnel symptoms at night. You might wake up with numbness, tingling, or even pain in your hand or fingers. This happens because we often sleep with our wrists bent, which increases pressure on the median nerve. Nighttime symptoms can disrupt your sleep and may become more frequent as the condition worsens. If you find yourself waking up and needing to shake out your hands, it could be an early sign of carpal tunnel syndrome. Weakness in your hand is another early sign to watch for. You may notice that it's harder to grip objects, open jars, or perform tasks that require fine motor skills. This weakness is caused by the median nerve not functioning properly due to compression. Over time, you might even start dropping things more often. If you notice a decrease in your hand strength, especially in the thumb, it's important to pay attention and consult a healthcare professional. Pain is a classic symptom of carpal tunnel syndrome, and it often starts subtly. You might feel aching or discomfort in your wrist or hand, sometimes radiating up your arm. The pain can be mild at first, but may become more intense with repetitive activities or prolonged use of your hand. If you notice persistent pain, especially when using your hand for tasks like typing or driving, it could be an early warning sign. Another early sign is increased clumsiness. You may find yourself dropping objects more frequently or struggling with tasks that require precise hand movements, like buttoning a shirt or picking up small items. This happens because the median nerve controls some of the muscles in your hand, and when it's compressed, your coordination can suffer. If you notice a pattern of dropping things, it's worth considering carpal tunnel syndrome as a possible cause. A burning sensation in the fingers or palm is another symptom that can appear early in carpal tunnel syndrome. This burning feeling is often described as uncomfortable and may be accompanied by tingling or numbness. It usually affects the same fingers as other symptoms: the thumb, index, middle, and part of the ring finger. If you notice a persistent burning sensation in your hand, especially after repetitive use, it's a sign to pay attention to. Some people with early carpal tunnel syndrome report a sensation of swelling in their fingers, even if there's no visible swelling. This feeling can be uncomfortable and may make your fingers feel stiff or difficult to move. The sensation is caused by nerve irritation rather than actual fluid buildup. If your fingers feel swollen or tight, especially in the morning, it could be an early sign of nerve compression. Carpal tunnel syndrome typically affects the thumb, index, middle, and part of the ring finger. The little finger is usually not affected because it's served by a different nerve. Knowing which fingers are involved can help you distinguish carpal tunnel syndrome from other hand conditions. If you notice symptoms mainly in these fingers, it's a strong clue that the median nerve is involved. Early symptoms of carpal tunnel syndrome often appear or worsen during certain activities. Tasks that involve bending your wrist or gripping objects tightly, like driving, typing, or holding a phone, can trigger tingling, numbness, or pain. If you notice that your symptoms get worse with specific activities and improve when you rest your hand, it's a sign that your median nerve may be under stress. A classic sign of early carpal tunnel syndrome is the need to shake out your hands to relieve symptoms. Many people find that shaking their hands helps reduce tingling or numbness, especially after waking up or after repetitive activity. While this provides temporary relief, it doesn't address the underlying problem. If you find yourself frequently shaking your hands, it's time to pay attention to your symptoms. As carpal tunnel syndrome develops, you may notice a decline in your fine motor skills. Tasks that require precise finger movements, like buttoning clothes, writing, or picking up small objects, become more challenging. This is due to the impaired function of the muscles controlled by the median nerve. If you're struggling with these everyday tasks, it could be an early sign of nerve compression. Early symptoms of carpal tunnel syndrome may be mild and infrequent, but they tend to worsen over time if the underlying cause isn't addressed. Tingling, numbness, and pain can become more persistent, and hand weakness may increase. If you notice your symptoms are getting worse or lasting longer, it's important to seek medical advice before permanent nerve damage occurs. Certain groups of people are more likely to develop carpal tunnel syndrome. These include individuals who perform repetitive hand movements, such as office workers, assembly line workers, and those who use vibrating tools. Other risk factors include pregnancy, obesity, diabetes, arthritis, and previous wrist injuries. Knowing your risk can help you stay alert for early warning signs and take preventive measures. Common triggers for carpal tunnel symptoms include repetitive motions like typing, using a mouse, or gripping tools. Activities that involve forceful or awkward wrist positions can also contribute. Even hobbies like knitting or playing musical instruments may increase your risk. Being mindful of these triggers can help you modify your activities and reduce strain on your wrists. Diagnosing carpal tunnel syndrome early can prevent permanent nerve damage and improve your chances of recovery. Doctors may use physical exams, nerve conduction studies, or imaging tests to confirm the diagnosis. If you notice early warning signs, don't hesitate to consult a healthcare professional. Early diagnosis allows for less invasive treatments and better outcomes. During a physical exam, your doctor may check for signs of carpal tunnel syndrome by tapping on your wrist, Tinel's sign, or asking you to flex your wrist, Tinel's test. These maneuvers can reproduce symptoms like tingling or numbness, helping to confirm the diagnosis. If these tests trigger your symptoms, it's a strong indicator that the median nerve is involved. If you suspect you have early carpal tunnel syndrome, there are simple self-assessment techniques you can try. Pay attention to when and where you feel tingling, numbness, or pain. Notice if symptoms worsen with certain activities or at night. Try gently tapping your wrist or flexing it to see if symptoms appear. While self-assessment can be helpful, it's important to consult a healthcare professional for a definitive diagnosis. Making small changes in your daily routine can help prevent or reduce early carpal tunnel symptoms. Take frequent breaks from repetitive tasks, use ergonomic tools, and maintain a neutral wrist position. Stretching and strengthening exercises for your hands and wrists can also be beneficial. These lifestyle modifications can go a long way in protecting your median nerve and keeping your hands healthy. Ergonomics play a crucial role in preventing carpal tunnel syndrome. Adjust your workstation to keep your wrists straight and your hands at or below elbow level. Use a supportive keyboard and mouse, and avoid resting your wrists on hard surfaces. These adjustments can help minimize pressure on the median nerve and reduce your risk of developing symptoms. Regular stretching exercises can help relieve tension in your wrists and hands. Simple stretches, like gently bending your wrist back and forth or spreading your fingers wide, can improve flexibility and reduce pressure on the median nerve. Incorporate these stretches into your daily routine, especially if you perform repetitive hand movements at work or home. Wearing a wrist splint, especially at night, can help keep your wrist in a neutral position and relieve pressure on the median nerve. Splints are a simple, non-invasive way to manage early symptoms and prevent them from getting worse. If you're experiencing nighttime tingling or numbness, talk to your doctor about whether a wrist splint might be right for you. If you notice persistent tingling, numbness, or weakness in your hand, it's important to see a doctor. Early medical evaluation can help confirm the diagnosis and start appropriate treatment. Don't wait until symptoms become severe. Early intervention can prevent permanent nerve damage and improve your quality of life. Treatment for carpal tunnel syndrome depends on the severity of your symptoms. Early cases may respond well to rest, splinting, and lifestyle changes. More advanced cases might require medications, physical therapy, or even surgery. The key is to start treatment early, before symptoms become severe. Your doctor can help you choose the best approach for your situation. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage mild pain and inflammation. In some cases, doctors may recommend corticosteroid injections to reduce swelling and relieve pressure on the median nerve. Always consult your healthcare provider before starting any medication for carpal tunnel symptoms. Physical therapy can be very effective for early carpal tunnel syndrome. Therapists can teach you exercises to stretch and strengthen your hand and wrist, improve posture, and reduce nerve compression. Therapy may also include techniques to improve blood flow and reduce inflammation. Early therapy can help you avoid more invasive treatments down the line. In severe or persistent cases, surgery may be necessary to relieve pressure on the median nerve. The most common procedure is carpal tunnel release, which involves cutting the ligament that forms the roof of the carpal tunnel. This surgery is usually quick and has a high success rate, but it's typically reserved for cases that don't respond to other treatments. Prevention is always better than cure. To reduce your risk of developing carpal tunnel syndrome, practice good ergonomics, take regular breaks, and avoid repetitive or forceful hand movements when possible. Pay attention to your posture and keep your wrists in a neutral position. Early action can help you avoid the discomfort and limitations of carpal tunnel syndrome. If you work at a desk or use your hands for repetitive tasks, there are several ways to protect yourself from carpal tunnel syndrome. Adjust your chair and desk height, use a wrist rest, and position your keyboard and mouse for comfort. Take short breaks every hour to stretch your hands and wrists. These small adjustments can make a big difference in preventing symptoms. There are several home remedies that can help manage early carpal tunnel symptoms. Applying cold packs to your wrist, resting your hand, and doing gentle stretches can provide relief. Avoid activities that trigger symptoms and keep your wrist in a neutral position as much as possible. While home remedies can help, they should not replace professional medical advice if symptoms persist. There are many myths about carpal tunnel syndrome. Some people believe it only affects office workers or that it always requires surgery. In reality, anyone can develop carpal tunnel syndrome, and most cases can be managed with non-surgical treatments if caught early. Understanding the facts can help you take the right steps for prevention and care. Pregnant women are at higher risk for carpal tunnel syndrome due to fluid retention and hormonal changes. Symptoms often appear in the second or third trimester and may resolve after delivery. If you're pregnant and notice tingling, numbness, or pain in your hands, talk to your doctor about safe ways to manage symptoms during pregnancy. Athletes who use their hands intensively, such as cyclists, tennis players, or weightlifters, can also develop carpal tunnel syndrome. Repetitive gripping and wrist movements increase the risk. Early recognition and modification of training routines can help prevent symptoms from worsening and keep athletes in top form. While carpal tunnel syndrome is rare in children, it can occur, especially in those with underlying medical conditions or genetic predispositions. Symptoms in children are similar to those in adults, including tingling, numbness, and weakness. Early recognition and treatment are important for preventing long-term problems. Ignoring early warning signs of carpal tunnel syndrome can lead to serious complications. Prolonged nerve compression can cause permanent numbness, muscle weakness, and loss of hand function. In severe cases, muscle wasting in the thumb can occur. Early recognition and treatment are essential to avoid these long-term effects. Genetics can play a role in your risk of developing carpal tunnel syndrome. Some people are born with a smaller carpal tunnel, making them more susceptible to nerve compression. If you have a family history of carpal tunnel syndrome, be extra vigilant for early warning signs and take preventive steps. It's important to note that other conditions can cause symptoms similar to carpal tunnel syndrome. These include arthritis, nerve injuries, or problems in the neck or shoulder. If your symptoms don't fit the typical pattern or affect other parts of your arm, your doctor may need to rule out other causes before confirming carpal tunnel syndrome. To recap, the early warning signs of carpal tunnel syndrome include tingling, numbness, pain, burning sensations, weakness, and clumsiness in the hand, especially in the thumb, index, and middle fingers. Symptoms often worsen at night or with repetitive activity. Recognizing these signs early can help you take action and prevent long-term complications. If you notice any early warning signs of carpal tunnel syndrome, don't ignore them. Make lifestyle adjustments, seek medical advice, and follow recommended treatments to protect your hand health. Early action can make all the difference in preventing permanent damage and maintaining your quality of life. There are many resources available for people experiencing carpal tunnel symptoms. Support groups, online forums, and educational websites can provide valuable information and connect you with others facing similar challenges. Don't hesitate to reach out for support and guidance as you navigate your symptoms and treatment options. If your symptoms persist or worsen, consulting a hand, specialist, or neurologist can provide more targeted care. Specialists can offer advanced diagnostic tests and recommend the most effective treatments for your situation. Don't hesitate to seek expert advice if you're concerned about your symptoms. In conclusion, recognizing the early warning signs of carpal tunnel syndrome is essential for protecting your hand health and preventing long-term complications. Pay attention to symptoms like tingling, numbness, pain, and weakness, especially if they affect your thumb, index, or middle fingers. Early intervention, lifestyle changes, and medical care can help you manage symptoms and maintain your quality of life. Thanks for watching, and take care of your hands.